Dr. Kaylee Garrett Zimmerman here, physical therapist. Today I really just wanted to give you a heads up on what it is that brought me to pelvic floor physical therapy and why I enjoy it so much, really why it's my passion. I have had several different pelvic floor issues throughout my life. I was a ballet dancer for the majority of my life. I had stress incontinence, which is where when you laugh, sneeze, jump, run, you would leak on yourself a little bit. And I also have had pain with intercourse. So those things, as you can imagine, can be pretty detrimental to a young female's journey to becoming a young woman. And so I just always thought they were normal because the people that I was around would say that these things were normal, that it was just something that you dealt with. I was not someone that wanted to talk to my mother about those things or wanted to talk to other female clinicians about those things, such as my gynecologist. However, once I started to get a little bit older, I went to physical therapy school and we had one course on what pelvic floor PT was. I became pretty interested, but at that time I was like, that's not going to be what I'm going to be treating. That's really not what I want to do. Got into physical therapy, started doing it, and I went and observed someone who is quite phenomenal here in the Tampa Bay area, and I observed her for quite some time, and that is really what sparked my interest. I fell in love with the ability to spend 45 minutes to 1 hour with your patient. I fell in love with the ability to form such a personal connection with your patient because you really get to get on those deep levels of conversation. You talk about everything with pelvic floor. You talk about your pelvic floor issues, which are very personal, and you also get to know that person on a personal level, and then you become really good friends. And I really enjoyed that, and I also really enjoyed the fact that in such a small way you can help somebody. You can give them hope. So that was really an interesting take for me. I really enjoyed that. I loved that part of it. And then I loved the ability to be able to treat things that I was going through. I felt it on a personal level. I was able to acknowledge that, and I was able to portray that to my patients on my interviews and on my evaluations and on that first day. So I'm really excited for the new things that are coming in my career, and I'm really excited for the new things that I will be bringing to you. Stay tuned. This upcoming week we also have pelvic floor issues and how to handle them with performers, because I was a performer myself. And if you have any questions or comments, or even you want me to cover a topic, please just drop that topic below and I would love to cover that for you at some point, okay? All right, guys, thank you so much. I just wanted to share my passion with you and share my why. I love what I do and I'm very excited about it. I do still love my orthopedics, so I do still treat the general population with back pain, neck pain. I love spinal pain, ankle, foot, all of that good stuff. I just happen to have a specialty and a niche when it comes to pelvic floor. And that can be anything with incontinence to pelvic pain, pain with intercourse, before having a baby, after baby. The pelvic floor is a huge umbrella. There's a whole lot of things that go under it. You've got diastasis recti, or separation of the core. We've got a lot of breathing techniques we teach people. We've got pelvic floor strengthening, pelvic floor coordination, pelvic pain. There's a little bit of rain dripping on my roof. I apologize. All right, guys. So anyways, if you have any specific questions about that, please let me know. I'd also love to connect with you if you've dealt with some pelvic floor issues, because I have, so I know what it feels like on that level. So, all right, I hope you have a fantastic rest of your day.